Hi, I'm Michelle. I'm getting tummy tuck, a BBL, breast augmentation, and lift. I guess just kind of like what I said, do something for myself, make me feel good. I'm never worn like a two-piece swimsuit in my life because I had my son when I was 17, so this is something I've always kind of wanted to do. I'm sure it'll change it quite a bit. I'm already pretty confident, but I'm hoping to just be able to wear stuff that I haven't worn before, so super excited about that. So I don't live here, I live in Washington State, and I just, the results, number one, and then the reviews, and then I just have been researching like on, you know, like Facebook blogs and things like that, and have heard really good things. And then the process just leading up to it as well, when I called in and stuff, it felt really easy, and I guess just like wearing different things, and I always tell people I can't wait till I'm healed, so I guess that's what I'm most looking forward to, is just seeing like the final results and being able to go back to working out and things like that.
So the case today is very interesting. She's had previous submuscular breast augmentation, but she has animation deformity. For me, when I use Motiva implants, I like to put those implants above the muscle to decrease the effect of the muscle pushing the implants off to the side over time. So the goal today will be to remove her old implants. We're going to take that muscle, we're going to suture the muscle back down to the chest wall where it originally was. I'm going to place a mesh and then put the implants above the muscle, and that's also going to help give her more cleavage. She has some breast drooping from previous breastfeeding, pregnancy, and age. So we're going to do a breast lift. We're going to move her nipples up to a higher position on her chest wall and cut out a lot of the extra tissue. In regards to her body, she's had liposuction years ago. She's had a BBL. She still has a lot of fat, and she doesn't have the ideal shape in her hips and her butt that she wants. So our goal today will be to really contour her back, her sides, her stomach with Lipo 400 using VASER, and really help to round out the buttocks as much as possible and give her a nicer contour to her hips. And then last but not least, we're going to go in and make a low bikini incision, really tighten the muscles of her abdominal wall and remove that extra skin, give her a nice new innie belly button to complete the mommy makeover. Ready for a timeout? All right, our patient today is a 38-year-old female with no known drug allergies who's here for VASER Lipo 400, a BBL, removal and replacement of silicone implants with mesh, mastopexy, and an abdominoplasty. The ANSEF was given?
1 minute after arrival, yes.
Okay. Her hemoglobin today is 15.1, up from 10.3, with the help of a preoperative iron infusions and her oral iron as well. As mentioned before, no known drug allergies, any anesthesia concerns?
No anesthesia concerns.
Any tech concerns?
No.
Any nursing concerns?
No.
All right, so doing a revision lipo case. Patients had previous lipo and BBL, so I'm doing a round 2 lipo and BBL. So I always start with tumescent, which is just this clear fluid as you see. This fluid has epinephrine and some other pain medicines in it that helps to expand the tissues, which helps decrease bleeding and helps for more efficient fat removal. Followed by that, I'll use something called the VASER. VASER is just an ultrasonic device that helps break up the fat from the tissue, especially when there's scar tissue. People ask, why does my lipo rarely have any contour regularities? I think a lot of it has to do with not only my technique, but also using the VASER to help break up the scar tissue, which helps decrease the risk of lumpy, bumpy deformities after liposuction. One thing interesting about this case today is her preoperative hemoglobin was 10.3. We gave her 3 iron infusions because her iron binding capacity along with some other numbers were extremely low. With a combination of those iron infusions plus some preoperative vitamins that we make you take for about 2 months, we got her hemoglobin up from 10 to 15. That is extremely significant. If her hemoglobin was 10 today, I would not be able to do the mommy makeover case because that just puts her at too much risk of needing a blood transfusion post-op. And so to avoid those things, we have certain protocols in order to get your iron and hemoglobin up. In addition, we always check it the day of surgery because just because you have a high preoperative lab you may have had a menstrual cycle or a period, and those numbers may have decreased. And so one of the ways that we keep you extra safe is we check your iron and your hemoglobin levels the day of surgery in addition to pre-op. All right, so this patient's had a previous submuscular breast augmentation, and one thing that happens over time is that muscle can often push down on the implants and cause them to lateralize. And so when patients lay down, the implants often fall off to the side, and that's what typically requires pocket repair. What I'm going to do today is I'm going to take these old implants out, I'm going to put the muscle back down, I'm going to suture back to the chest wall, and then put the implant subfascial or above the muscle so that we get better cleavage in the middle and we have less risk of these implants falling off to the side, in addition to adding a mesh for support of these new implants. All right, so I've removed the implant from here. You can actually see her ribs. And so her previous implant was placed below the muscle, but I find that most implants below the muscle really aren't below the muscle because her muscle is here, but it's done something that's called window shading, which the muscle is way up here. So the implant is supposed to be under the muscle, but it really isn't. So what I'm gonna do today is I'm gonna release this muscle and pull it back down to where it should be. So I'm gonna cover up this rib cage. Her pocket has been really expanded out laterally here. So the implant has been pushed way out into her armpit. So I'm gonna help close this pocket so that the implant sits more towards the center today. So before you could see the rib cage and the actual ribs, now I've taken that muscle which was previously lifted up and I've dissected it down and I've sutured it back down to the chest wall. So the implant will go on top of the muscle now. And so that will help with her animation deformity and it'll help from the implant being pushed off to the side. So today I'm using a mesh with her breast implant revision case. So I use a mesh for a couple of reasons. One is to support the bottom of the fold so that the implant doesn't fall and bottom out. The second reason is it helps decrease the risk of capsular contracture, and that's where scar tissue forms around the implant. In general, mesh is very, very safe. It's not a permanent mesh. It does dissolve over a couple of years, but what happens is it leaves behind scar tissue, which helps to support the tissue over time, especially in people who have lost a lot of weight, who have very thin, frail tissues. The mesh is very, very helpful in supporting those implants long term. So I'm repairing the pocket, particularly the lateral side where the implant is pushed out and open and spread the pocket over time. I do something called popcorn capsulorrhaphy. So I use cautery and it creates oftentimes a popcorn sound, and that's just the sound of the tissue contracting. So you may be able to hear it. All right, so I have the old implant out. I put the muscle back down and I've added a mesh. And now I have the new 625cc ergonomics full profile implant in. And so that mesh really helps to stabilize this lower pocket here. So I've sutured the mesh down to the ribs. And so that's gonna help stabilize so this implant doesn't fall or drop over time. So this will eventually become scar tissue, but you can see as I push down on the implant, the mesh is helping to hold everything in place. All right, so we're getting ready to start the breast lift portion of the case. I've taken out her old 457cc silicone implants. I replaced them with Motiva full profile ergonomic 625cc's from a submuscular pocket to an over the muscle pocket with mesh. So I'm just sitting her up to assess my symmetry. I have good upper pole fullness on both sides. But the main reason why she needs a lift is because she has all this saggy tissue. So if I were to do nothing else but just exchange the implant, she would still have this waterfall deformity, as we call it, because it's almost like the breast tissue is going over the implant like a waterfall. So I need to remove this excess tissue and then raise this nipple back up to a more anatomic position. All right, so I've started the breast lift, and many patients ask, well, how do you get the nipple from down here to up here? And we don't take it off and glue it back on. We actually leave it attached to some tissue. So there's many blood vessels that provide blood and oxygen to the nipple. And so we want to leave all those attached. And so all those are attached under all this tissue here. And so what I'm going to do is, the nipple is under my finger here, but I'm actually going to lift this up and suture it up here. So we don't take it off and glue it back on. We leave it attached to the surrounding tissue. And once we've freed up and dissected around it, we can now suture it in place at a higher position. All right, so I finished the bilateral removal and replacement silicone augmentation with mesh and pocket change and a anchor scar mastopexy. So the implants are in good place. We do have incisions, but those will eventually be covered with tape, which we'll leave on for about 4 to 6 weeks. So now I'm gonna move on to the anterior part of the Lipo 400 and abdominoplasty. So oftentimes people wonder, can I just get away with liposuction or do I need a tummy tuck? I always tell people, if you have loose skin before, you'll definitely have it afterwards. I equate kind of the skin to the outer shell of a balloon and the fat to the air in the balloon. And once you deflate that balloon, you often get a lot of loose skin. So this patient, she's had several kids, and you can see that she just has a lot of extra skin. There is fat underneath here, no question, but after I remove that fat, she's gonna have a lot of skin. And so you can see she has stretch marks from pregnancy. And if I just do lipo, she's gonna have a lot of extra skin. So a lot of people think that liposuction is just fat removal, but it has a very, very artistic approach and feel to it. And each artist, no matter who they are around the world, they have a different approach to the canvases they use and the type of paint they use. Even as plastic surgeons, we all use different instruments to remove fat. But at the end of the day, that artist has a vision. And so each surgeon has a vision of the underlying anatomy and what to do with it. And that's kind of what shapes our ultimate liposuction finished product. And so for me, I call my Lipo 400 because it has some uniqueness to it in the way I put in my tumescent, the way I remove the fat, the way I contour the body, whether it's the back, the arms, the stomach. In my opinion, nobody's lipo looks just like mine, and vice versa. And so it has a very unique artistic feel to it. So I've completed the liposuction, so I took about 1 liter off of fat just on her abdomen. So it is safe to do liposuction of the abdomen when you're doing a tummy tuck. You just cannot be aggressive in the superficial areas, otherwise you will compromise the blood supply. Alright, so I've done my standard tummy tuck incision, I've done my dissection all the way up into the belly button. And so I try to save the belly button in most cases, as long as there hasn't been extensive surgery or scarring within it. So what I've done is I've made an incision around the belly button, and I've essentially freed it up from this abdominal skin. The belly button naturally is attached to the muscles down below. And so what I'm gonna do is just kind of continue to free this up so that once the tummy tuck part is done, I can reattach it to the skin once I've pulled everything down, repaired the muscles, and closed. So this is the belly button, and you see it doesn't move because it's attached down below. If you've ever seen someone you know that's had a tummy tuck, or if you've had one yourself and you're pretty snatched up in your abdomen, your waist, and your sides, but your private area, your pubic area is really puffy, it's often because that area was either not liposuction or the fat was not removed. So even though I've done liposuction in this area already, you can see there's still a lot of fat that doesn't come out with liposuction. So while I'm doing the tummy tuck, I always like to remove this extra fat so that you have a nice contoured pubic area. All right, so I'm gonna get ready to do the muscle repair. So this patient has several kids, and so what happens is your abdominal wall gets really lax, and that's because of several reasons. One is because this fascia, which is the white part enclosing the muscle, that gets stretched out. So if you look over here, this is her oblique muscle, and that's kind of the muscle that's here on the side that connects to your rectus muscle. Your rectus muscles are right here, so this is her middle of her six-pack right there. In between, there's something called the raphe, or a midline depression that connects the two sides of the rectus muscles. When people typically measure diastasis, they usually measure the distance between the two sides of the 6-pack of muscles. However, if you just repair just the diastasis that's right here, this little white line that's here, you're still going to have some laxity of the abdominal wall. And so what I like to do is kind of overcorrect by tightening some of this fascia out laterally. So now I've done my signature triple plication. And so you remember how loose her abdomen was before, but now you can see how tight it is. Those oblique muscles, which were over here, have now been brought closer to the midline because I've tightened out that fascia so much. And so now we have a much more stable core, much flatter abdomen. Her diastasis has been repaired, and this should give her a much, much flatter abdomen. So I've removed the extra skin, and you can see this little hole here, that's her old belly button. So we've removed all the skin from the top of her belly button all the way down to her pubic area. You can see some of the areas where her pubic hair was before. It's interesting, patients, you know, when we do a tummy tuck, we always try to pull the skin as tightly as possible, but in a safe manner. But skin can always stretch out, just like you can have a baby and get pregnant. You can gain weight and your skin stretches. So no matter how tight we pull it, at some point it's going to relax to some degree. Same with the breast, no matter how much we put them, how high we put them up, they are going to droop a little bit over time. Same with the facelift. You do a facelift, 10-15 years, you may need a slight revision or another one. So as you can see here, I pulled this stomach pretty tight. I really can't pull it any tighter. But over time, this will loosen up just a little bit, and that's extremely normal. Because it's so tight, we have to have you walking and sleeping in an upright position or kind of bent over for a few weeks, just so you don't put a whole lot of pressure on this incision. Even though I do 3 layers of sutures, we don't want you popping and pulling on those sutures. So this is a picture of just how much skin came out. So this was previously on her abdomen, and like I said, that was the previous belly button hole. No amount of lipo alone would have fixed this problem. She certainly needed a tummy tuck, so she got the right operation today. All right, so just finished a huge mommy makeover case. Lipo 400, BBL, remove and replacement of silicone implants with mesh, pocket change on the implants, and a sculpted tummy tuck with muscle repair. So as you can see here, she has a nice low incision that's going to hide well in her bikini. She has a very nice innie belly button. Switched her implants, which were about 450 cc silicone, to 625 cc Motiva high profile ergonomics implants with the mesh to help support the lower pole. You can see that she has a nice upper pole fullness. She's going to have very nice cleavage. She'll have some nice definition to her abdomen.